I'm deeply honored to join you this morning to officially open the third annual scientific conference here in the bustling city of Suva, and it's my humble opinion that the theme of the conference, infectious diseases, threats, and opportunities, is most timely and apt. Over the past few years, outbreaks of deadly viruses and resistant bacteria have caused havoc in many nations. The recent outbreak of Zika virus even threatened the success of the Rio Olympics. These diseases have also affected many Pacific Island nations that have limited resources and expertise in effectively managing and preventing their spread. Fiji is no exception. It has suffered from outbreaks in numbers of hepatitis A, leptospirosis, typhoid, and dengue fever. Recently, our Ministry of Health and Medical Services has tried to deal with cases of Zika, chikungunya, and newer strains of influenza. Additionally, rising numbers of HIV/AIDS and non-communicable diseases create significant health burdens to our services providers, and the associated rising costs of treating them inevitably causes further strain to our national economy. On a positive note, these outbreaks bring to the fore certain deficiencies in the healthcare systems in Pacific Island countries. They provide an opportunity for all of us to improve our knowledge, experience, and healthcare services. They also allow us to create partnerships with experts and organizations to improve healthcare systems and facilities. More importantly, it enables our people to be more aware about healthy lifestyles, hygiene and good sanitation, and hopefully compel them to make the right choices. As Fiji's lead advocate and champion in our campaign to eliminate NCDs in Fiji, I relate very closely to the challenges that Pacific Island countries face. I'm also very encouraged that we are making every effort to address these challenges. I consider NCDs and related ailments as a scourge and a clear and present threat to national social and economic progress, which requires our collective attention and remedial actions. For Fiji in particular, the right to access health care services, including reproductive health services, is guaranteed in our Constitution. This right to health is indispensable to realizing the rights to life and dignity for all our people. Some of the challenges to realizing this right include the need for new scientific technologies to prevent, diagnose, and treat all illnesses, the need to strengthen public health systems through investment and support, and the need to ensure access to clean water, nutrition, decent shelter, and evidence-based public education. As Fiji's president, I'm pleased to note that Fiji is making significant headway towards overcoming most of these challenges. The Fijian government, for instance, has placed unprecedented focus and attention on improving the infrastructure, education, and health sectors, which for the most part of the past decades have received the highest budgetary allocations. The allocation of significant resources and attention to these sectors has come after detailed analysis of Fiji's real needs, or simply put, where we need to invest in order that we can achieve our ultimate objective of a healthy and prosperous nation. The focus on education has resulted in the provision of free education from preschool right up to secondary level. It has also resulted in the reprioritization of tertiary scholarships to enable Fijians to achieve higher qualifications in areas like science and technology, including medical science, among others. Government continues to reform the education system and is also investing significantly in both academic and vocational education and training in the effort to attain a healthy and knowledgeable-based society. The focus on the health sector is essentially on repositioning the country's health system not only to cater for the increased demands for improved health care driven by an improving socioeconomic status, but also, importantly, to put in place appropriate approaches to preventative and curative measures. And in view of this, our health authorities are receptive to new ideas and proposals that will assist in achieving targeted outcomes and national goals. Government has also channels record-level resources to improve the country's water supply system by extending treated and piped water to more rural and urban communities. Fiji's water standard is consistent with the requirements of the World Health Organization, which places it amongst the most hygienic and safest, at least in the region. As a young and developing nation, all these developments are and will continue to be ongoing as work certainly in progress. This is why I would also like to commend and congratulate the organization, the Internal Medicine Organization of the Pacific, for establishing what I understand is a very special forum within the broader health sector. I'm reliably informed that internal medicine is a specialized field in medicine that diagnoses and manages patients from adolescence to adulthood with medical problems that are not normally surgical, obstetric, or gynecological in a major hospital. I have a plea to all health professionals to be more understanding and compassionate with your patients so that when they leave your clinics, ward or outpatient, they leave with the satisfaction that the care provided to them is of the highest standard. They leave satisfied and in high hope and in great respect for you. In a time of high technological advances in medicine, what is striking is the number and complexity of flashing monitors one would encounter next to a patient in a hospital, which could be rather confusing to patients and loved ones, and it is our collective responsibility to reassure them that they will be well looked after. I note with appreciation that the organization has brought together specialists from public and private sectors, academics, and international presenters from reputable health and medical departments and establishments to share knowledge and skills with a view to providing quality health care in the field of internal medicine within the region. Indeed, an annual scientific conference such as this is an ideal opportunity to come together as medical professionals to discuss issues of mutual interest, share your experiences, and more importantly, learn from one another. You are meeting at an opportune time in the history of healthcare in this country when the Ministry of Health and Medical Services is developing a policy framework to guide and improve service delivery in this country. I congratulate you once again, and I encourage the organization and all participants here to play a leading role in the control of infectious diseases in the region by sharing your knowledge and experience and expanding your knowledge and skills, and by collaborating with relevant international counterparts. I also challenge you to follow in the footsteps of Victoria's Olympic gold medal winning Fiji Sevens team, who have defied all odds and barriers to achieve glory. It was a win for the Pacific. With these remarks, ladies and gentlemen, I now take great pleasure in officially opening the Internal Medicine Organization of the Pacific, third annual scientific conference. I wish the conference a resounding success, and I look forward to learning of the outcomes of your deliberations and how we can collectively work together in maintaining and improving the standard and quality of lives within our respective communities. To all our visitors, I hope that by the end of the two-day conference, you will be able to find time to enjoy our Fijian hospitality, and may you have a safe return home. May Almighty God bless you and all our beloved nations. Thank you all.